And thank you for joining this evening. Because this is going to be recorded, as Darlene mentioned, everyone is in listen-only mode, meaning you can hear me, but I cannot hear you. But as we do have a manageable size group, would like you to feel free to ask questions, and we can interrupt during the course of the presentation. And best way to do that would be by using the messaging tool. Darlene will be able to read those and can interrupt me to ask when the time is most appropriate. The title of this presentation, and it's the first of what we're calling the SafeStep Secrets of Success series, is to discuss a program that we developed called WorryFreeDME. About a year and a half ago, Medicare and a number of its associated agencies began to undertake a whole series of pre- and post-payment audits, asking suppliers to provide copies of the required documentation, much of which was incomprehensible to suppliers and caught many by surprise, and really instilled a whole lot of fear among podiatrists, so much so that a whole lot of people actually have dropped out of the Medicare therapeutic shoe program. And if there's one overreaching objective of this presentation, is to assure you that the expectations of these audits are reasonable, understandable, and manageable. And it is a responsibility that we are assuming to make it easy for you to do what you need to, so that you can, number one, continue to provide appropriate care for your patients, and number two, be able to grow your practice in the way that therapeutic shoe fitting can enable. Now, the explanations that I'm going to give with regards to the Medicare's requirements are clearly spelled out if you know where to look. And many of these documents that I will refer to are referenced, archived, available to read on the SafeStep website in what we call the Medicare compliance section. And included in there are notifications, announcements from some of the different Medicare DMERCs. Included is here you see actually a documentation checklist that makes very clear the 6 different documents that would be fair game for Medicare to ask for in an audit. And those documents, right, are as listed here, and a prescription for therapeutic shoes and inserts, and as required, it would be written by the podiatrist, a statement of therapeutic necessity. That is something that is to be signed and dated by the MD or the certified physician managing the patient's diabetes. Relevant medical records, that is documentation from the MD, consistent with the risk factors of the patient. A copy of a supplier, in this case the podiatrist, their evaluation to determine the type of shoe that's most appropriate for the patient. Dispensing soap notes that would be written by you at the time that the shoes are fit. And lastly, a certificate of receipt, something signed by the patient indicated they have received that which Medicare is to be billed for. Now, there is the response or the thought of most podiatrists when presented with having to provide all this different documentation has really been very overwhelming. And as I mentioned, for many it has resulted in their completely dropping out of the program. For most, even who have stayed in the program, it has resulted in their feeling so overwhelmed that they fit many fewer shoes than they have the opportunity to do. And this really was the impetus for our creation, again, what we call the Worry-Free DME program. And it consists of a number of different elements that we're going to go through here. Okay, and what Worry-Free DME consists of is creation of required Medicare documentation, assistance with reminding patients of the importance of an annual foot risk assessment and replacement of shoes that have been dispensed. And 3, assistance with obtaining from the certifying physician the documentation needed for them to sign. And you put these 3 things together, and we came up with a theme that we think applies very much so to podiatrists, and that is what we are trying to do is to provide compliance and convenience so as to be able to provide for the podiatrist increased cash. We are so confident of the veracity, the accuracy, and the completeness of the 6 form documentation forms that we create that we have created. We have a $10,000 guarantee, meaning that if you are audited, asked by Medicare to provide documentation and provide the forms that we have created based on your data input, should Medicare deny payment and should you exhaust all the appeals, we will reimburse you that which Medicare is denying. So, how does one get started? Fundamental to success in the diabetic shoe program is the establishment of what we call the number. We refer to the number as the number of patients in the practice with diabetes and Medicare. Again, the number is the number of patients in the practice with diabetes, with diabetes and whose primary payer is Medicare. It's said that if you can't measure something, you cannot manage it. The number is the benchmark by which you can determine in January approximately how many shoes you should hope to be able to fit by December. We created a place on the website for you to capture that number so that it remains a constant reminder. Okay, every single patient in the practice who has Medicare and diabetes should be appointed for a separate, have a separate dedicated appointment to have what we call a comprehensive diabetic foot exam. This is an annual visit to determine a patient's risk for ulceration. We think that this should be communicated to the patient as important to the patient as it would be for a male to have an annual prostate exam, for a woman to have an annual mammogram. If a patient has diabetes, they should have an annual foot risk evaluation. We call it the comprehensive diabetic foot exam. Medicare has actually established a preventative care program called PQRS that will actually reward podiatrists for performing preventative care measures. Those measures include checking patient circulation, checking patients with diabetes feeling, and 3, checking patients with diabetes shoe fit. Those are all components of the CDFE, and so by performing a CDFE, you will by definition satisfy Medicare requirements for PQRS, and in enable you to earn an end-of-year bonus. By performing a CDFE on every single patient in your practice with Medicare and diabetes, you will, in addition, without a doubt, identify instances where the patients might benefit from additional services, such as if it is determined that there is vascular compromise, if there are non-palpable or diminished pulses, increased capillary refill time, or edema present, it might be an indication. It might indicate the possibility of peripheral vascular disease, an indicator to consider you're performing non-invasive vascular testing. If there is evidence of decreased protective threshold, it might indicate to you the need to perform nerve fiber density testing. The performance of the CDFE provides you with the opportunity to educate the patient and effectively convey to them the significance of the risk that they are at by having their diabetes, and I think in the patient's eyes provides an opportunity for you to help them understand that this program by Medicare is actually not known as the Medicare Free Shoe Program, but is actually more appropriate, or is more accurately known as the Medicare Therapeutic Shoe Program. Once you perform the CDFE, if you determine that risk factors for ulceration are present, you as a podiatrist can write and should write a prescription for depth or custom molded shoes and 3 pair of either prefabricated or custom molded inserts. Now we're going through the step-by-step of the process for evaluating patients and when indicated fitting for shoes. So on the separate CDFE visit, once performing the evaluation, again, if a patient has been determined to have a risk factor in addition to their diabetes, that means decreased circulation, decreased feeling, or a structural deformity, could be as insignificant, I shouldn't say insignificant, but as minor as or as little as a hammer toe. That is a foot deformity that would qualify for patients even if neurovascular status is intact. Again, patient with Medicare and diabetes can qualify for shoes with a hammer toe even if the neurovascular status is intact. So if a risk factor is determined to be present, it would then be appropriate to recommend to the patient an appropriate style and brand of shoe. And so I suggest that that be done on that visit when the CDFE is determined. Once determining the style and the brand, use a measuring stick and hopefully a shoe display to figure out the best length and width for the shoe, and then lastly decide whether the patient would best be fit with prefabricated heat molded or custom inserts. The information, the shoe fitting and diagnostic information would be recorded on a form that we can provide, following which you should go to the SafeStep website and enter this patient and insurance information. That includes the patient name. We ask, have you yet obtained the necessary documentation from the medical doctor, that being the certifying statement and a copy of their relevant medical records? These both default to no. That is where you should most likely use it if the patient, unless the patient has presented you with some of this compliance documentation. So again, indicate that you do not have the relevant medical records from the certifying physician. There is then also the opportunity to indicate the diagnoses as you have determined from your CDFE. Enter all this information. Again, it only takes 2-3 minutes to enter the information that you collected from the CDFE onto the SafeStep website. We asked you, did you perform a CDFE? This is our way of helping you to ensure that you perform the PQRS measures on at least 50% of the patients with Medicare and diabetes, thus qualifying for the PQRS bonus. The SafeStep website will present to you the three measures that you should include with the 99213 office visit code and submit to regular Medicare in order to bill for that visit. Medicare will keep track of how many patients you have submitted, G8404, G8410, and 2028F. They know how many patients you submit those measures for and compare it to the number of patients in your practice with a 250 diagnosis. If the PQRS measures are sent on 50% or more, Medicare says, thank you for providing good preventative care. We will reward you with an end-of-year bonus equal to 0.5% of your total Medicare payment, from total Medicare payment. This program is in 2 years going to penalize you for not submitting these measures. So better sooner than later, get used to doing it, because right now there's a reward associated with doing it. Soon enough, there's going to be a penalty for not doing it. So once you enter the patient and shoe and diagnostic information, you are done. SafeStep will now fax as though from you the required documentation, that being the certifying statement and the findings from your CDFE, to the certifying physician. Again, the documents will come looking as though they are from you, with a customized cover letter telling the doctor that the patient has been determined to qualify, has been evaluated, has been determined to qualify for shoes, to please sign and date those 2 forms indicating their agreement with your findings, and to enable their patient to qualify for an annual pair of shoes. SafeStep will fax those forms twice a week for up to 3 weeks. We are successful at getting those forms for you 50% of the time within the first week, more than 90% of the time after 3 weeks. When we are unsuccessful, which occurs, again, less than 10% of the time, we will let you know so that you can try yourself, or perhaps give the forms to the patient for them to obtain signature and date, and so that they can then be fit with shoes. Only after we receive the signed forms and verify the accuracy of the signatures will we send those forms on to you, along with the shoes and inserts that you had ordered previously. When the shoes are received by you, you should go back to the SafeStep website, click Received. This will then put the order on a call list for you. There's no need to write anything down. It will also the website will also then print out for you all the required forms, including a prescription, a certificate of receipt, that's something for the patient to sign, the 30 supplier standards. Again, you're required to provide that to the patient when you give them their shoes and inserts. And lastly, we will create for you a dispensing soap note. That's that will describe what you did as far when you dispense the shoes, that you went over the break-in instructions with the patient, that the patient was advised of the warranty information and was happy with what you gave them. The certifying statement that is sent to us is now required by Medicare to be signed and dated no more than 3 months prior to when the patient was fit with shoes. Again, the shoes must be fit no more than 3 months after the patient is fit with shoes. Additionally, Medicare, in its effort to promote a team approach to care, requires that the patient be seen by their medical doctor and their diabetes condition reviewed no more than 6 months prior to when they got fit with shoes. So again, there are two time frames that you need to be aware of. The certifying statement is only good for 3 months from the date it is signed, and 2, patients must be seen by their medical doctor for a review of their diabetes no more than 6 months prior to when the shoes are fit. When the patient arrives to pick up their shoes, if the shoes are being dispensed with prefabricated inserts, once the shoes have been assured of fitting, prefabricated inserts should be heat molded. Patient then is given a copy of the supplier standard and signed and gets a copy of the certificate of receipt. Medicare requires those break-in instructions to include the patient's name and address, and that they got a copy of the supplier standards. Again, you keep a copy, you give the patient a copy. The dispensing soap note, again, must be specific for the items that have been dispensed, should indicate that the patient's shoes fit well, that they're happy, that they've gotten a copy of the supplier standards. Because these time frames are so important to be aware of, we indicate on the SafeStep, we call the dashboard, when documentation is on the verge of or has expired. So long as there is at least a month until a form, until a form has expired, meaning the certifying statement, or since when the patient was last seen by their medical doctor, we indicate on the dashboard in the color green that things are still okay. When documentation has expired, it turns to red. When there is a month or less until expiration, the order is indicated in yellow. Okay? Qualified patients are entitled to shoes and inserts each calendar year. The dashboard displays when people have gotten shoes in the current as well as each of the 2 prior years. It is astounding how commonly patients who have received shoes in the past are not fit with shoes in the subsequent year. Again, it's astounding. Most patients, most to all patients who qualify for shoes 1 year should be fit with a replacement pair of shoes, meaning that the shoes demonstrate some wear and are in need of replacement each year. In actuality, most podiatrists do a very poor job at identifying those patients that they have fit in the past, and most do not perform a comprehensive diabetic foot exam on all, and actually less than 1 in 4 patients on average who are fit 1 year are fit the next. Again, less than 1 in 4 patients fit 1 year are fit the next. In order to help you fit patients year after year after year, SafeStep has, as part of WorryFreeDME, we call a patient retention program. In addition to displaying a list of all your patients who have been fit with shoes and when they got them each year, we can provide for you customized patient mailers that remind patients of the importance of coming in for an annual exam and to be fit with a replacement pair of shoes if they are determined to qualify. It is now half the year is gone. The majority of patients who were fit last year should probably have already been evaluated, and if they qualify, fit with shoes again. I can tell you that more often than not, this has not yet been performed. It can be extremely helpful for you to monitor what we call the DME dashboard. Again, we put right in front of you your recorded number of patients in the practice with Medicare and diabetes, and present to you the number of patients fit with shoes each year. We present to you the percentage of patients that you have fit thus far. Patients with diabetes and Medicare fit thus far. I can tell you that very conservatively, 50% of the number. So if there are 450 patients in the practice with Medicare and diabetes, very conservatively, 225 will qualify for shoes. More realistically, 75% probably qualify. So if you do have 450 patients in the practice with Medicare and diabetes, I would expect 300, 350 of those patients with diabetes to qualify for shoes. And that's why we show you that percentage. Of course, in the beginning, when 2 out of 450 are fit, that percentage number is going to be very low. But towards the end of the year, towards 3/4 of the year, that number should be upwards of 50, 75% if you're doing a good job at fitting your patients who you've identified. That repeat rate, as I said, is in many instances hovering or planted somewhere below 25%. That number really should be upwards of 75%. We also track for you the number of people in the practice who have had PQRS measures reported, as well as that percentage. Again, qualification for the Medicare end-of-year bonus requires that 50% or more of the patients with diabetes and Medicare have their PQRS measures reported. Okay, so we said here, compare the number of patients that you fit with the number. As you mentioned, generally 50% or more of patients with Medicare and diabetes have risk factors qualifying for them for shoes and should be fit. Repeat rate should be 75% or more. I'll bet dollars to donuts that every single person on this webinar has a repeat rate that's less than 75%. So, in summary, I wanted to just run through the step-by-step of what it means to fit people with shoes and perform a foot risk evaluation using the worry-free process. Again, it's once a patient has been evaluated and a shoe style selected, SafeStep makes it easy for you to place that order online. SafeStep will then take over. You are done. SafeStep will contact the MD to get the certifying statement and the diabetes management notes signed and dated. They would be sent to SafeStep. We would review them for compliance and archive them online. Should you lose them, we would be able to reproduce a copy for you. Only after the forms are received and reviewed for accuracy will shoes and inserts be shipped to you. The website provides you with order status tracking so that patients could actually be appointed even before the shoes come in. Once the shoes come in, patients will be fitted. The website will provide you with your dispensing chart note and patient receipt, and once the patient has come in, is fit with shoes, and everything fits well, if desired, SafeStep can provide electronic billing to Medicare at a rate of 0. We will do electronic billing to Medicare for free if desired. So bottom line, what we try to provide with Worry-Free DME for the podiatrist is the idea of providing for you compliance, increased convenience to make your office more efficient. We say it's better for you to be fitting than faxing. Using the service will without a doubt result in improve cash flow and improvement in the bottom line. So again, I would encourage you, when you place your orders online, we do give you the choice of entering orders simply as it would be from any other manufacturer. That is, just enter the order, we ship you the shoes. But I would encourage you to click the button that says Use Worry-Free DME. Let us get the documentation, assure your compliance, and then ship you the shoes. Any questions now? That was a lot to go through. I do want to mention that in order to encourage you to use some of the tools that we think will make you most successful, those of you on this presentation can get a $100 discount should you place an order for one of the different display stands that we have available from both Apex and OrthoFeet. These displays of different sizes are regularly $199 and $299. For those in attendance, $100 off. So a 30-shoe display would only be $99. A 42-shoe display, $199. And so let me see if there are any questions. If so, please type them in, and Darlene will be able to read. And thank you very much.
Thanks, Josh. That was a great presentation. Even myself, as much as I've heard you and give this presentation myself, I always learn something new. As of the moment right now, we do not have any questions, but happy to take those questions, so go ahead and type those in, or raise your hand and I'll be happy to take you off of the listen only and let you ask the question to Josh directly. All right, we do have a question, so hold on just a moment. Steve, are you able to hear us?
Hello, can you hear me?
Yes, we can hear you.
Okay, thanks. Yeah, I was just wondering, on the website too, the DMERC, it's also available to bill for other devices such as the ankle foot orthosis or the walking cast boots. Is that true too for the patients as well, that you could submit the billing for the devices of that nature?
Yeah. It's a good question. I'm glad that you brought it up. Yes, SafeStep can bill to the Medicare DME carriers, not regular Medicare, but for DME, including shoes, diabetic shoes, inserts, prefabricated, and custom AFOs. And the deal that we offer is that if the item has been purchased from us, the billing is free. Even if the item has not been purchased from us, we will bill it at a flat rate of $9.99. That is generally much less than would be the cost were you to use a billing service that charges 5 or 6 or 7%.
Okay, thank you. In reference to that again too, Dr. White, do you like, say for instance, if the person had a cam walker and you had it from your office, although it wasn't purchased from SafeStep, but so therefore you can still bill for that. And do you have like a list of the codes available for the different devices, even if you order from you all too?
Let me show you. Let me just
thank you.
Let me just go right there and I'll give you a quick look. So if I go to the SafeStep website and I log in, you can use the site for billing and creation of compliance documentation as well, by simply clicking where it says just the documents, clicking where it says prefabricated AFOs, and scrolling down to the HCPCS code, the appropriate HCPCS code. In the case of a walking cast, we have here the L4360 prefabricated pneumatic, or the L4386 non-pneumatic. look left or right, continue, enter or select the patient's name, continue. Here is your information, physician managing the patient's foot care. Continue. Here is the code. Here it defaults to the Medicare allowable. And here is a short list of generally appropriate diagnoses. So simply click on the appropriate diagnosis, hit continue, and enter the date which the device was dispensed. 7/12/12. Hit submit. Cannot be a future date. My mistake. 7/1/12. Hit submit. And then you're done. That order is continued. Now you can generate the required documentation, including a soap dispensing soap note. And I'll show you what that all looks like. Preview. Here is a prescription. Here is a dispensing soap note. Here is a patient receipt required to be signed by Medicare. Here are dispensing supplier standards that you're also supposed to dispense. And lastly, the document of medical necessity. So just like shoes have documentation requirements, prefabricated and custom have very similar requirements. And if all those documents don't seem familiar, I would strongly encourage you to register for another webinar that we do over here. I'll show you attend online conferences, and we do one here called Essentials of DME Medicare Compliance. That will go over the documentation that's required for a prefabricated and custom AFOs. Do you the gentleman who asked the question, do you currently use a billing service?
Yes, I do, Dr. White.
So if you're paying, say, 6% for when dispensing a pneumatic walker that reimburses over $300, you're paying in the neighborhood of $20.
No.
So I would suggest buy the device from us and save that money, or don't buy it from us and pay $10.
Oh, okay. Thank you.
Okay.
That's considered Medicare Part A too, isn't it?
Well, it's Medicare Part A is hospitalization. So
okay.
We're talking about billing to Medicare Part B.
Okay.
Through the Medicare carrier.
Alrighty.
All right.
By the way, you have an excellent website, and it's really nice to play around with it, and it's just amazing how many features you have. And
yeah.
Thank you.
Yeah, I appreciate that, and it's in some ways is an expression that says sometimes something's greatest strength is its greatest weakness, and part of the reason for doing these live presentations is to better familiarize people with all the things that we do have available. So thank you.
Thank you very much, too.
You're welcome. Anything else? Anyone here, if you could indicate on the, raise your hand if anyone on the call has had a Medicare shoe audit. Just interested to know. And while you're thinking out there, there's one. Okay, good. In our Medicare compliance section, or in our library section, I want to show you, we have one of the world's largest collections of audit letters. And this is, I think, valuable to view to know what you might expect from Medicare. And again, I can say with confidence that if you use the Worry-Free program, you have nothing to worry about. Slow down, collect the necessary information, enter it into the website, and be done with it. Okay? We've studied these letters. We know what they're looking for, and we'll give you the documentation that they want. Okay? Okay. Any other questions? Darlene, did you want to show some do you have something that you were able to show, or is it now not going to be a good time?
Unfortunately, it has not finished processing. So
Okay.
I'll have to send that in a separate email to everyone.
So let's also show then here in the library section, we archive these presentations. So you'll see, like right over here where it says Medicare Therapeutic Schubert Comprehensive Diabetic Foot Exam. You can click there and have access to recorded versions of these presentations. So I would encourage those of you listening to both sign up for these scheduled presentations and also reference the library section here, where there's a tremendous amount of information available. Okay. Any other questions before we wrap it up? Darlene, what's the date of the next scheduled Secret of Success?
The next one is August 14th at 8 p.m. And that is, you're going to demonstrate how everyone can improve their fit rate.
Okay.
And their repeat
Great.
rate.
Their repeat rate.
Yes.
Okay. August 15th.
14th. August
14th. Okay. Very important, because that's the time of year when everyone should be focused on identifying those people who've been fit in the past and who have not yet been fit this year, and make sure that they get in to be evaluated before it gets too late.
That's right.
Okay. So, all right.
Josh, I believe we're done. There are no further questions. If in the event a question arises a little later, tomorrow, next week, please feel free to email any one of us. You'll have all of my contact information and Josh's information in our follow-up emails. And then also you can contact corporate office at 866-712-7837 and ask to speak with a customer service representative, or if you know your account manager, Gina or Christine, they'll be happy to connect you with one of them.
Okay, then. All right. Thanks very much, and good night.
Thank you, everyone.